Hi students, today let me talk about BMR, basal metabolic rate, right? I am going to give the salient features for your basal metabolic rate. First one is definition. Minimum amount of energy which is required by the body to maintain life at complete physical and mental rest in the post-absorptive state, that is after meals, 10 to 12 hours after meals. Minimum amount of energy required by the body to maintain life at complete physical and mental rest in the post-absorptive state. The normal value is 35 to 38 for males and 32 to 35 for females. Unit is calories per square meter per hour. Very, very important. Calories per square meter per hour. Measurement is, we have only one apparatus, Benedict-Roth apparatus. Benedict-Roth apparatus, which is useful for the measurement of BMR. What are all the factors affecting BMR? There are so many factors. I am going to give some 5 important factors. You try to present 5, all the 5. First one is thyroid hormones. This is directly related to BMR. In hyperthyroidism patients, the BMR level will high, whereas in hypothyroidism patients, BMR level will be low. Second one is, in men, usually the BMR is high. Infants actually increased BMR, whereas they coming to adult, the BMR is decreased. And BMR is increased in always the athletes because of the higher physical activity. Starvation, the BMR is automatically decreased. Fever, you know the changes in fever which leads to increased BMR. That too, if the BMR is increased by 10% means the temperature will go up to 1 degree Celsius. That is 10% of BMR will lead to increased temperature 1 degree Celsius. Some diseases, leukemia, polycythemia, Addison's disease also increased BMR. And finally, what is the significance of this BMR? Important to calculate the calorie requirement, that is planning of diet, very, very important. Assessment of the thyroid function, BMR is very useful. Some kind of diseases also influence the BMR, leukemia and polycythemia like cancer diseases will affect the